This video is meant for individuals who has undergone or will be undergoing breast reconstruction using abdominal flaps. For the ease of understanding, a red band has been used to mark the operated arm in most parts of this video. This video should not be used against any medical advice. If in doubt, please clarify with your physiotherapist or medical team. We will briefly cover the following: what to expect after your operation, regaining movement with your physiotherapist, exercises you can do to facilitate your recovery, and physiotherapist follow-up after discharge. What to expect after your operation? Once the operative procedures have been completed, you will be nursed in a high dependency unit. You will have to adopt a jackknife position in bed where your hips are slightly bent. Your operated arm should be slightly away from your body to avoid pressure on your newly reconstructed breast. You may have drains, lines, and a urinary catheter attached to you while you're still in bed. You can start taking in deep breaths and holding them for 3 seconds. Repeat this 10 times every waking hour. This will allow your lungs to expand and improve your intake of oxygen. If you feel the urge to cough or clear your throat, use your non-operated hand to apply pressure over your abdominal wound before doing so. This will help you cough more effectively. Thirdly, be sure to move your ankles in a pedaling motion to improve circulation in your legs. Your physiotherapist will reinforce these points to you on your first session. Now that you have had your breast reconstruction, you will need to keep your hip bent at least 30 degrees during sleeping, standing, and walking for the first 2 weeks. You may apply an abdominal binder to provide more wound support before you stand or walk. Ensure that the binder does not press onto your breast when applied. Remember not to apply pressure on your newly reconstructed breast or push and pull using your arm on the operated side at all times. Your physiotherapist will be assisting you to get out of bed and walk on day 2 onwards. They will continue to assist you until you are able to mobilize on your own. Keep a small space between your operated arm and your body by resting your hand over your tummy. Bend your hips and knees before rolling onto your non-operated side. Remember to always get up from your non-operated side. If you are receiving assistance, ensure that support is given on the non-operated side to avoid pressure over the flap. Lower your legs towards the ground and push up to sit with your non-operated arm. Stand up slowly while keeping your hips bent and begin your walk. As you get stronger, you will be able to get out of bed on your own. Place your hand on your tummy, bend your hips and knees, turn to the non-operated side, and push with your non-operated arm. Remember to still keep your hips slightly bent in the upright position. If you have had bilateral breast reconstruction, ask for assistance to get out of bed as you are unable to use any of your arms to assist you. Someone should be helping you up by supporting your back. In this way, you will not strain any of your arms while getting out of bed. Even though you are not allowed to lift more than 1 kg after your operation for the first 2 weeks, you should be able to still do light activities like holding your mobile device or a cup of water. Next, here are some exercises that will facilitate your recovery. Firstly, shoulder roll. Roll your shoulders forwards and backwards about 10 times and repeat this 3 times a day. Scapular retraction. pull your shoulder back, hold for 3 to 5 seconds and relax. You may also roll your knees side to side. This can relieve any backache that you may have after the operation. Shoulder flexion. From the second day onwards, you are encouraged to lift your arm up to 90 degrees of shoulder flexion. You are also encouraged to move your shoulder up to 90 degrees of shoulder abduction as shown in the video. 1 week or 7 days after your operation, you may use the wall to assist you to achieve full shoulder range as before the operation. Please be reminded that you should not feel anything more than a slight stretch when you are doing these exercises. If you encounter pain, tightness or pulling, do not force the movement. In summary, you are allowed to move your shoulder up to 90 degrees after the operation. After the 4th day, you are allowed to move your shoulder to 120 degrees, and in a week, you are allowed to move your shoulder to full range. Physiotherapy follow-up after discharge. You might be discharged about 8 days after your operation, and you may go home while drains are still attached. A physiotherapy appointment will be arranged within 1 to 2 weeks after you leave the hospital. You will then be taught ways to improve range and strength during your outpatient physiotherapy follow-up. Continue to keep active while you are at home with activities like walking and performing exercises taught earlier. For any queries you may have, do refer to the information booklet or check in with your physiotherapist during your outpatient appointment. Till then, stay strong and take care.